Now, with many people out and about in Gauteng, the busiest province, and busyness as usual in many cases, there are fears of a second wave of COVID-19 in South Africa's most populous province. Gauteng has almost 20,000 active cases and has had about 225,000 cases to date, with about 4,600 deaths. There are about 3,000 people still in hospital in this province. For more on the situation, whether or not quarantine and isolation sites will be closed, we're chatting now to Acting Health MEC Jacob Mamabolo. Acting MEC, thank you for being with us. Just tell us the situation in Gauteng. We've seen overall as a country the numbers starting to pick up slightly, but still nowhere near where we were at the peak. How would you describe the state of the province?
Firstly, thank you very much and good evening to all the viewers. Let me confirm that yes, as a province, whilst we note that almost on a day-to-day basis, our numbers vary between 300, that's the rate of infections, 300 to 400, stabilizing around 350 or so. We deeply worry that that number is not radically shifting closer towards zero rate of infections. So when it stabilizes for a fairly longer period of time and it's not showing a drastic reduction, that could have implications that, as a surge and increase could potentially, hit us. But let me just say to the viewers that this weekend on Saturday, as the provincial government, and of course more in particular ourselves as the health department with other departments, will be looking at ways of improving and strengthening our work to say to the people of our province, to the private sector, restaurants, community leaders, to churches, to all stakeholders that we work with, families, that we need to intensify the best practices that have helped us to succeed, to fight and push back the spread of COVID-19. We are deeply, deeply, deeply worried that we are seeing a trend where the rate of interaction amongst people, compromising social distancing, and the relaxation by the people on the wearing of masks, and just the activities we are seeing that are highly risky, like taverns, even restaurants. A number of them we're seeing interaction that really is very worrying because levels of non-compliance seems to be high. So we want to intensify our effort to go back to the people again and work with them. Because remember, in Gauteng, the projection is that towards the end of the year, we may have a second surge. So that is going to be a function of what we do now and right here, and that's what we're doing.
300 to 400 cases in a province of millions seems low, and maybe that's adding to the reality for some people. It feels like COVID-19 is hiding. They don't know people who have it or who have suffered recently. But like you say, this could all change by the end of the year. But people are tired, acting MECs. Is it hard to get this message through at the moment?
Let me just acknowledge that, it has been very difficult for our frontline workers, particularly health workers, who have really had to work so hard and endure heavy workloads that they are not used to. And remember that even with the economic activity opening up, we are seeing people driving recklessly. That means more numbers for our accidents and emergency wards. And so the pressure on the front line is definitely concerning, but also the people themselves. We will work very hard with them because If we just look at what is happening in other countries, if we look at just Europe itself, as an example, they had initially thought just exactly what you are saying. They thought COVID is gone, they could relax, they could, open up. Now look at what are happening. They're actually going back to some of the alert levels that we have passed. So that should say to the people of our province that what is happening in the world can happen right here. One person reckless in a community can infect the whole township, the whole suburb, the whole residential area. So we have to make sure that we work hard to a zero rate of infection, and that's going to depend on the people appreciating the message that what's happening in these other countries can happen right here in our province. Moreover, we are a cosmopolitan province. The borders are opening. Most of these people are coming here. So we need to intensify our work. And I can assure you, when you look at what we're going to be doing next week, you'll actually see us on the ground, re-energized, hard at work. The political leadership of the province who are going all out. The community leaders. You're going to see us in our communities with our healthcare workers and community workers who are going back to intensify the message that we need to rely on non-pharmaceutical solutions. They're still the backbone of our struggle. Wear your mask, wash your hands, sanitize, keep social distancing, don't go to crowded places. People organizing funerals must still be very, very, very vigilant. So that message is coming renewed. You are going to see us in full force, engaging with the people to say, let's comply. So we will push COVID-19 through hard work, and that's what we're going to do.
Acting MEC, we're running out of time. Just tell us what's happening with isolation sites, quarantine sites. Some of those were closed down in the Western Cape, but apparently Nasrec will actually stay up for now. Is that correct?
So what the approach we came out with as a provincial government is that to optimize resources, use limited resources better, to leave good legacy, to improve our facilities. Let us invest in hospitals. We are now only going to leave Nasrec as our key consolidation point, but you'll see us unveiling, as we did in Para with the Premier last week. You're going to see us unveiling more capacity inside the hospital, because we must use money of the people carefully, optimally, and to the best that can sustain good quality public health care.
All right. Thank you very much for your time. Acting Health MEC in Gauteng, Jacob Mamabolo.